Hello, my name is Jenny Begley and I'm a learning disability practitioner. In this podcast, I'm going to talk about learning disability in the pre-hospital environment. A learning disability is a reduced intellectual ability and difficulty with everyday activities. For example, household tasks, socialising or managing money, which affects someone for the whole of their life. A learning difficulty is different from a learning disability because, unlike learning disability, it does not affect intellect. It is estimated that 20 in every 1,000 people in the UK have a learning disability. Care for people with learning disability needs to be person-centred, depending on the individual needs of the person. There are many types of learning disability and associated conditions. In this video, we will consider some of the more commonly presented ones, namely Down syndrome, Fragile X, attention deficit hyperactivity disorder, and autism. Down syndrome, a genetic condition caused by the presence of an extra chromosome in the body's cells. Down syndrome is not a disease, and it's not a hereditary condition. It occurs by chance at conception. Each person with Down syndrome is affected differently, but most share a number of physical characteristics and problems with their development. Fragile X. This is an inherited condition resulting in intellectual impairment. It is also the most common known genetic cause of autism. Some characteristics are learning disability, attention disorders, anxiety, mood swings, autistic behaviour, and occasionally seizures. Autism. Autism is a lifelong developmental disability that affects how a person communicates with and relates to other people and the world around them. When overloaded with too much sensory stimulation, an individual with autism may lash out or become totally withdrawn. A person with a learning disability is likely to have a degree of autism, but autism itself is not a learning disability. ADHD, attention deficit hyperactivity disorder. ADHD is a group of behavioural symptoms that include inattentiveness, hyperactivity, and impulsiveness. The exact cause is unknown, but the condition has been shown to run in families. It can occur in people of any intellectual ability, although it is more common in people with learning difficulties. The following are learning difficulties that a person may have as a result of a learning disability. Dyslexia, difficulty reading. Dyscalculia, difficulty with mathematics. Dysgraphia, difficulty writing. Dyspraxia, difficulty with fine motor skills. Dysphasia and aphasia, difficulty with language. Let's dispel some common myths. Myth number 1. People with a learning disability are not intelligent. A diagnosis of a learning disability means there will be a reduced level of intellect, but do not assume that the person is unintelligent. It's important to note that most people with a learning disability can and do establish highly effective coping strategies. Myth number 2. People with learning disability are unable to effectively communicate. Most people with learning disability can communicate very well with the right support, but this might not always be verbally. Myth number 3. People with learning disability present with challenging behaviour. Challenging behaviour is not a natural occurrence of learning disability. There is never behaviour without reason. A kick, a shout or a scream is a means of communication and usually occur when trigger behaviours haven't been identified. Therefore, challenging behaviour is only such because the cause has not been identified and reacted to correctly. So what does this mean in clinical practice? Here are some practical tips. Tip number 1. Good communication. It is vital that you begin with the assumption that a person with a learning disability has capacity to understand everything you're saying to them. Take time to establish a good rapport with the person. Make reasonable adjustments to your communication style as required, for example, using clear, simple language and avoiding leading questions, and then confirming the person has understood everything. Ask closed-ended questions that can be answered with a plain yes or no. Allow the person time to process information before moving on to the next question. Remember that people with learning disability may communicate more effectively by using aids such as a picture chart and/or a health passport. Tip number 2, pain recognition. Unrecognised pain is often a reason for changes in behaviour. Pain displacement is not uncommon in learning disability, and a hurting arm could actually be a fractured tibia or fibula, for example. It is vital that you undertake a thorough head-to-toe survey, checking the whole person and not just the part that is claimed to be hurting. Tip number 3, diversion and de-escalation. Many people with a learning disability and associated autism will each have a threshold limit for particular sensory stimuli. This threshold will affect how noise, light or touch is perceived and processed. Specific behaviours are triggered when that threshold is reached. These behaviours can include rocking or moving rhythmically, followed by an attempt to move away from the stimuli, or even shouting and hitting out. Even though the time it will take an individual to reach their threshold will vary from person to person, generally it will take around 90 minutes for a person to de-escalate after reaching this state of sensory overload. During this time, any repeat of the sensory stimuli which caused the overload is likely to place that person back up to the threshold limit immediately. Therefore, all reasonable attempts to remove or reduce the stimuli should be made, i.e. by dimming bright lights and minimising excess noise. Diversion techniques include physically guiding someone away from stimuli, distracting them by talking to them, or getting them to look at something different. Tip number 4, the unconscious patient. When managing an unconscious patient with a learning disability, the clinician should pay particular attention to any relative or carer present, as they will have far more information than the average bystander. In a care setting, it would be a good idea to ask if the patient has a health passport, as this should travel with the patient. Many people with learning disability live independently in their own homes. As a direct result, someone with a learning disability might be alone when they have the need for the ambulance service. It's especially important that we're able to recognise and meet their needs as a unique individual, making any reasonable adjustments required.